Chances are you or someone you know has been diagnosed with cancer. 1 in 3 people are diagnosed at some point in their lifetime. But how much do you really know about it? Do you know your risk for cancer? Did you know there are 2 types of cancers that develop in different ways? The first type is hereditary cancer. Only about 10% of cancers can be categorized as hereditary. This means that 10% of individuals affected with cancer develop the disease due to inherited genetic mutations from either parent. Knowing if your cancer is due to inherited factors can be useful in deciding which screening tests, prevention options, or targeted therapies to pursue. Some cancers can be common within a family, and the inherited mutation can be passed down to further generations. Such families will oftentimes have multiple relatives with cancer, not necessarily of the same type, and most likely will be affected before the age of 50. If you suspect hereditary cancer in your family, it's recommended that you meet with a genetic counselor who can provide you with a personalized genetic cancer risk assessment and determine if genetic testing is a good option for you and your family. Being aware of this information allows you and your doctor to determine a preventative treatment plan for early diagnosis, such as mammograms, colonoscopies, and CT scans. You may also be empowered to adopt a healthier lifestyle and increase awareness in your family. How is hereditary cancer screening done? Hereditary cancer screening is done by testing the DNA extracted from a blood sample. A couple considering having a baby may wish to have their DNA tested to screen for mutations in certain genes that are associated with common and rare hereditary cancers. This allows them to determine the possibility that they'll pass on genes that may cause cancer in their future children. ReproGenes uses next-generation sequencing technology to test samples and analyze them for mutations associated with both common and rare hereditary cancers. Why should we get tested? A hereditary cancer screen can provide you information about certain genetic risks that you might have. This information is important because if you find out that you are at risk, you can discuss preventative options early on with your doctor. In terms of trying to start a family, there is a 50% chance that your genetic mutation could be passed on to your children. Knowing this can help you plan additional genetic testing that might be needed to reduce future cancer risks.